In this slide, I will be going over a case summary. EC is an 84-year-old Hispanic female who recently traveled to Mexico. After returning from Mexico, she began experiencing a change in mental status, which included increased confusion. She also experienced shortness of breath, cough, chest pain, and generalized weakness. EC has a medical history of hypertension, hyperlipidemia, coronary artery disease with previous stent placements, as well as frequent urinary tract infections. When the patient was in the emergency room, her vitals showed an increase in temperature as well as hypertension. A 12-lead EKG was done to rule out an MI due to her chest pain. The 12-lead EKG showed sinus rhythm with rare premature ventricular contractions. A chest X-ray was done which showed vascular congestion and infiltrations in bilateral lower lobes in the lung. A CT chest angiogram without contrast was done, which also showed the bilateral lower lobe infiltrates and vascular congestion. A urine sample was collected and results were negative for urinary infection. EC was diagnosed with pneumonia and started on Rocephin and azithromycin for the pneumonia. EC was being cared for by a registered nurse in the ER for approximately 6 hours before being handed off to another ER nurse. After only 10 minutes of receiving a report for EC, the ER nurse received orders to discharge the patient to the telemetry floor for further treatment. Due to the ER nurse not having had time to properly assess the patient and look after the patient's information and what treatments had already been done, the nurse giving the report to the telemetry nurse was unable to give enough information about the patient and enough information on what treatments the patient had already received. Before being discharged to any floors, patients are to be COVID tested per hospital protocol. However, due to quick patient handoff and bad handoff communication, the patient was not tested for COVID. The patient was discharged and sent up to the telemetry floor and placed on a regular, non-isolated room. This communication mistake caused a safety hazard for other patients and healthcare professionals caring for the patient.